A stunning announcement today from the state's largest hospital, one that could signal a sea change for one major health insurer in Maine. Good evening, I'm Pat Callahan.
And I'm Amanda Hill. Maine Medical Center in Portland says it will stop accepting Anthem insurance starting 2023. Chris Costa met with the hospital CEO this morning to learn more about why it's making this move. Chris?
Well, Pat and Amanda, CEO Andrew Muller says Maine Health is making this move because of two major issues, both around money. First, Anthem is withholding about $13 million from Maine Health. That's because Anthem says Maine Health is overcharging for services and medications. Maine Health said this morning they disagree, and they believe that they're charging the amount that they and Anthem agreed upon. The second, Maine Health says it is still short more than $70 million in delayed or denied claims. That's an issue we told you about back in November. Anthem has not responded to those claims. So what does this all mean for you? Anthem is the state's largest insurer, more than 300,000 people, including those who work for the state.
Here's the impact on patients. First, this only affects Maine Medical Center, the hospital in Portland. No other facilities or primary care doctors or specialists are affected. This change means if you go to Maine Medical Center for any type of routine or non-emergency care, including scheduled major surgeries, you'll likely have to pay a higher price. Maine Med will no longer be in-network for people who have Anthem insurance. However, emergency, trauma, or life-saving care are not impacted. That's because federal law requires insurance companies to cover those costs. What about your primary care doctor or specialist? If they work at any other Maine Health facility other than Maine Med in Portland, nothing changes. They still accept Anthem insurance.
We don't want to disrupt anyone's care by any stretch of the imagination. So we thought long and hard about all of our patients before making this decision.
What about Medicare Advantage plans? No change here either, even at Maine Medical Center. Maine Health also says it's getting rid of Anthem as the health care plan for its roughly 22,000 employees.
We can't have a health care plan for our own care team in which our own care team is out of network in one of our facilities. This is not really a discussion that we're excited about.
CEO Andrew Muller says they're alerting patients now to give them and healthcare workers time to prepare. His concern is that if this lack of payment continues, it'll start to affect the care and service Maine Health can provide.
We're at a point we feel as a healthcare system we've got to defend ourselves. This is an existential issue for us. So yeah, it's drastic because if we don't somehow get through this puts our ability to deliver needed services to our communities in jeopardy.
And what he just said at the end is critical. He said today that if Maine Health doesn't get paid, it might have to cut back services. He said the first to go would be the least used services, and in that case, it's the care in rural parts of the state. CEO Andrew Muller says he does not want that to happen. Now today, Maine Health sent a letter to 157,000 patients in its system who have Anthem insurance and got care at Maine Med in the last 3 years. Also, tens of thousands of employees who work for the state of Maine get their insurance through Anthem. Now late this afternoon, Governor Janet Mills issued a statement saying she strongly urges both Maine Health and Anthem to put the interests of Maine people first and resolve the issue quickly and avoid doing anything drastic. It is important to note Governor Mills' sister, Dora Mills, is the Chief Health Improvement Officer for Maine Health. Now, as for patients, keep in mind Anthem does not own all Blue Cross Blue Shield affiliations, so you'll need to check with your personal health insurance company to see if you are affected. Amanda?
All right, Chris, thank you.